I've been doing procedural sedation research in some shape or form really for 18 years right now, so it's been a long career and a very, very pleasurable career and journey in procedural sedation. The thing that got me into procedural sedation is I just couldn't understand when I was a medical student and a resident how we could have patients so comfortable and doing so well in an anesthetic state in the operating room, having all these very complex things going on, very painful surgeries, and yet we've got people asleep for those. How we could have that on one side, but yet then have patients suffering for emergency procedures and emergency events, suffering in terms of the pain that they were having as a consequence of their illness, but also when you would try to do things for them, put their shoulder back in place, put a hip back in place, set a fracture, things like that. It seemed to me that people were still having a lot of pain and suffering and anxiety, and I couldn't really understand why we were continuing to have that and having a culture to tolerate that when we had these medications. So that got me on the road to procedural sedation, and it's been a great road, and it's been one where we've had to slowly get down to all the different issues to address what our global concerns and all the questions inherent to procedural sedation in the emergency department setting. And even in the last couple of weeks, after 18 years of work, in the last couple of weeks we've had some very interesting developments where the federal government has been very interested in what we're doing and is finally embracing us and saying, yeah, the perspective that we've had all along in emergency medicine, that we should be sedating people and getting them more comfortable for a lot of these procedures, that perspective has been right all along. But it's been a long road of a lot of research and a lot of contemplation and a lot of work and partnering with people across the field of medicine. So how does that ultimately translate into improved care? Well, I think it gets us back to doing what we thought was right, supporting patients and getting them comfortable, and not sustaining a culture that tolerates suffering or illness that we don't have to have. It also supports patient safety and patient wellness. Those are essential factors all the time. And a lot of the conservative approaches that people had of not doing procedural sedation was grounded in safety. So we want to make sure we preserve those safety arguments and not do too much on behalf of being aggressive to sedate people too much, or things when it's not really necessary. So it's there's a lot of possibilities and a lot more research to do, and the interest that I've had and the interest that so many people over the last decade and a half have had in procedural sedation and emergency medicine has, I believe, gone a long way to decreasing pain and suffering, and I think that it's now something we will continue to see that culture develop and be supported to really help patients not have these painful procedures when we could do something a little bit different and treat them a little bit different and make the treatment more reasonable and tolerable for them.